All right, perfect. Thank you, everybody, for coming here today, in person at the Monroe County Health Department and also online via Zoom. Good to see you, everybody. This is sponsored and organized by the members of SUDAC, the Monroe County Substance Use Disorder Awareness Commission. And so just for awareness, like I said, this is being recorded and it will be made available for the public to view after the fact. So more information about this commission can be found on the SUDAC portion of the Monroe County website. This is housed under the Board of Commissioners topic area. So this includes meeting links, agendas, notes, etc. So for folks that are looking to tune in on Zoom or in person in the Nat U Hill room of the county courthouse, SUDAC meets every third Friday of the month from 12 noon to 1 p.m. So the charge of SUDAC is to serve in an advisory role to assist the government of Monroe County in planning and organizing educational community conversations throughout the year. So this includes the Opioid Awareness Summit, collaborate with stakeholders, gather community information related to opioid concerns and issues, and report its activities to the Board of Commissioners, at least on an annual basis. So we've heard interest in the community around supporting local recovery community or better supporting our local recovery community, made possible through the development of recovery community organizations, or RCOs. And we are super excited to be hosting this educational mini-series. So we had one prior, so last month, and that one is already on the SUDAC website. So just for anybody that's listening, according to the Indiana Recovery Network, a recovery community organization, or RCO, is an independent grassroots nonprofit organization providing a variety of activities available to all community members who are recovering from substance use. So this is not something that's restricted to individuals that are enrolled in a specific educational treatment or residential program. And just to set expectations for today, we're going to have Connection Cafe sharing for about 20 minutes, Wabash Recovery Center with about 20 minutes to share, and then the last 20 minutes for Q&A for folks that are in the room or online. So if you have any questions, put them in the chat, come off mute when it's the Q&A session. And with that being said, I'm excited to introduce our guest speakers for the day. So we've got Charmin Gabbard, Allison Green with Fayette County's Connection Cafe, and Molly Isles with Vigo County's Wabash Valley Recovery Center. So I will, or do you want to read a thing, or I can give a brief intro I'll give a brief intro for everybody. Charmin, so Ms. Charmin Gabbard is wonderful. She's the executive director of the Fayette County Connection Cafe in Connorsville, Indiana, a grassroots organization that she co-founded with Dr. Allison Green, a faculty member at Indiana University in 2021. So bringing more than 2 decades of experience in similar settings, Ms. Gabbard, she focuses on harm reduction and providing recovery services for those with substance use disorders and mental illnesses. And fueled by her own experience of substance abuse, misuse, and incarceration, Ms. Gabbard felt empowered to make a difference in her hometown, which has become significantly affected by the opioid epidemic. So serving as the new home of the former award-winning Fayette County Harm Reduction Alliance. Ms. Gabbard's goal at the cafe is to provide a safe place where a diverse population can receive support regardless of substance use and recovery by taking a holistic and patient-centered approach. Ms. Allison Green is an assistant professor at Indiana University School of Public Health Bloomington and an affiliated researcher with the Rural Center for AIDS and STD Prevention, the Southwest Institute for Research on Women, and the IU Center for Sexual Health Promotion. So as a health interventionist, Dr. Green conducts community-based participatory research with practitioners, agencies, and communities to address health disparities and improve sexual and reproductive health, substance use disorders for adolescents, families, and marginalized populations. And with Charmin Gabbard, Allison is the co-founder of the Fayette County Connection Cafe, and Molly Isles here. BSCAPRC2, CADAC 2 is the program manager and Vigo County CLEAR, so Choose Law Enforcement Assisted Recovery Coordinator. She holds a bachelor's degree in human services, specializing in addictions. While working in the Rockville Correctional Facility, she earned her CADAC 2, so that's a certified drug and alcohol counseling certificate. And during her time at RCF, she visited RWI Recovery While Incarcerated program, as well as taught reentry-centered classes, led addiction recovery programming. She's trained and certified in moral recognition and dialectical behavior therapy, and is passionate about her job and believes that peer support is critical to one's recovery path. She's a person in long-term recovery and wants to continue to work with other recovery supports throughout the community to expand recovery ecosystems. And now I talked a lot, so I'm going to hand it off to y'all.
Great introduction.
Thanks for being here.
Thank you. Yeah, thanks. So you want us to go first?
Sure, take it away.
Okay, then we'll go ahead and share our screen. Give me just a sec here.
I like your Phoenix.
Thank you. You're going to see a lot of the Phoenix here in one sec because it's on many of our slides, right?
That makes sense.
Well, thanks so much, Melanie, and thanks everybody. It's great to be here. Sherman, we're excited to talk a little bit about kind of how we got things started and where we've come since we started in 2019. It's been quite a journey, and we are happy to kind of share the model that we've been using. Kind of a quick caveat with that is, well, first I should mention on this slide too, you'll also see that we've got our two names in Courtney Alcott, who's on in the Zoom, and it's her birthday today. Happy birthday, Courtney.
Happy birthday.
Yeah, so we'll share a little bit about kind of our model. One quick caveat that I was about to say is that we've been doing more than we've been writing about the model until probably the last, I don't know, 6 months to a year. We've been really trying to capture it in writing. So this is really a draft that we're sharing of how we're conceptualizing it. So just keep that in mind. We can talk more about what we've been doing, but kind of putting it on paper, this is still in draft form, but we're feeling very good about it. So I'll kind of start by saying that. So a little bit about the cafe, and Charmin, jump in on any of this part as you want. Well, just a few things that we've got kind of on a timeline here. We mentioned that we started in 2019. We took a whole year. We were very fortunate that we had federal funding to take a year of planning, which felt like a gift. I mean, we had the entire year to kind of really figure out what's going on in the community. As Charmin can attest to, Connersville and Fayette County at the time had the highest overdose mortality rate in the state. Definitely very impacted the community. And so we spent the year talking to I should mention first, we formed a community academic partnership. So started working together and we started to learn as much as we can about what are all the community factors and the context that led to the rates being as high as they were in multiple areas in Connersville and in Fayette County. And so through interviewing folks from all different sectors, law enforcement, education, healthcare, behavioral health, education, et cetera, people with lived experience, on and on, as well as looking at local epidemiological data, as well as looking at kind of different national programs and interventions. We started to put together a bit of a plan. And as we were putting together a plan, we started kind of working closer in terms of what will it really take to enact change in the community. And we started thinking of all these different things. And Charmin and I always kind of reflect back to like a key moment where we were writing for the next funding that we did actually receive, which was a 3-year grant to implement programming. But as we were planning for that, I just really, as we were writing, asked Charmin, like, what will it really take? And she said, we need a space. We need a physical space. And so that was a big part of what we put into how we wanted to implement our programming. We wanted to implement all these different aspects in a physical space. And please,
I do want to say that.
Yeah.
So I actually was working at we had a 42-bed detox facility that opened and lasted 1 year before it went bankrupt. And prior to that, I had a part-time job at the health department working in the harm reduction program. And when we left that health department, we took the program with us. So I met Allison through that journey. They were doing all this research in Fayette County. So I wasn't part of that smart stuff. But then they contracted me and it just became the relationship. I got to start working with them under a fiscal agent as a contract employee. And then when Allison asked, she's like, what will it take? I said a place where people weren't in the back of a church or the basement of a building, where people can come to feel loved without judgment, but a space that's nice, where they can feel as if they deserve, because we always were given spaces, but it was, don't touch those chairs, don't do this. So, and I think that was real important, because if they know they matter, then they start to believe it. Okay,
Keep going. You're
back
good.
to.
So, and during that planning stage, the harm reduction program that you mentioned went down, right? Like it ended, unfortunately, and so there was a gap there. And so during our planning year, we brought that service back And we could talk on and on about all these kinds of things, but we want to get to the model. But we brought that back through collaboration with some community partners, through Meridian Health, through Reed, right? And kind of put that together. So yeah. So anyway, we had, once we went into our implementation funding, one of the first things that we kind of wanted to do was we wanted to take the harm reduction program, which had mostly at that point been syringe service programming, and naloxone distribution and stuff. And this was a little bit, and this was during COVID at this point. We started looking for spaces, right? At the time, we were just using a parking lot. Well, during COVID, we had a room in Meridian Health, had given us space to run the syringe service program at first.
And that quickly led to a lot of problems where, as providers, people oftentimes take it personal when their person doesn't recover the way they had wanted them to. So we had people that the case managers wouldn't bring to the program to receive services. And then, so it was quickly, the COVID was a gift for us because the stigma was real. And I was thankful for the opportunity, but when COVID happened, that's when we were able to start, like, things took off for us. COVID was a gift. And we got out of the building, so they let us use the parking lot until December of that year.
Yeah, you know, to go over the space.
And then, so we did, we happened upon a space, and it was right downtown on Central Avenue, and it was terrible. The space was terrible when we rented it, but it was affordable. And so the landlord was willing to rent to me, even knowing, like, this is what we're going to do out of there. I knew nothing about running a business, or I guess what we were getting ourselves into. But we did start looking. So there was, we wanted to, I had heard of Recovery Cafe, and I had met Brandon George, so a big mover and shaker. And then he had suggested for us to look toward that model. And we did. And then we quickly knew there was only, I think it was in the beginning stages of one cafe at that time. Amy Brinkley had really just came back from out west to start that. We knew it wasn't for us, for me. Quickly we knew, because of the you have to attend these groups, and then they had a 48-hour abstinence policy. There was funding, the investment, there was a lot of things. And what I know is people that have substance use and mental health issues sometimes can't make that benchmark. They just can't. And if someone is in active use, I want them in our space. So that way, if there is something going on, we can come up with those safety plans. I see it happened organically. I have a 12-step pathway background. And what I know now is that what changes people is loving people without 40-page intake packets and providing a resource. If somebody needs a shower, then they need a shower. If they need a dry pair of socks, then let's give them to them if we have it, without going through that and asking all their history and the trauma. That's so important. And so I'm sorry, I just took over here.
Please keep taking over. Yeah, so we kept kind of, so that was kind of the driving force, was we really wanted to serve anyone in need, regardless of whether they were in active use, whether they were in recovery. And so that was really that really helped drive our decision that we didn't at the time write into our programming the Recovery Cafe model for those reasons. We really wanted to try to integrate the harm reduction piece and hold on to that. And we really saw ourselves as a harm reduction cafe that integrated other services. And so through this journey, these are no small things, but I'll just run through them quickly. We became a nonprofit. We became certified as a recovery community organization. What else is up there? Yeah, so we can talk more about any of those things. But we want to shift and talk a little bit about kind of the model and approach, and then we'll get to kind of some of the services that we do. You know, we really see we see ourselves as a public health approach to integrated harm reduction, recovery, and community connection, which each of those elements is really important. And so being a public health approach, we really are, about protecting and improving the health and safety and well-being of the community. So we're looking at and we say Connersville and Fayette County, but the Connection Cafe is now serving 7 counties. So kind of looking around. So we're population focused. We're working really hard to reduce health disparities, to make healthcare and services and wellness more equitable and higher quality and accessible to all. And so that's really been a huge emphasis. And we've been data driven since the beginning, really kind of relying on what can we learn from what works, from kind of evidence, both from people locally and from scientific literature.
And the people we serve.
Absolutely.
Yes, and that's the biggest piece is,
100%.
I'm 10 years in recovery. Life is different out there now.
Yeah.
So to hear what they want and what they need is so important. Their voice, we have to have their voices. And if not, then we don't change what's been going on for years. We're still creating another cycle of giving services. And, you know, they may not need the whole backpack. They might need a tarp. So we have to ask them what they need and what they want. If everyone wanted to be a college graduate, that'd be like what a world it would be, but it's not everyone's goal. And everyone's not capable of abstinence recovery. For us, it's about where do you want to go and how can we support you to get there? And that's it. And there's not a day that goes by, like we serve about 135 people a week now in our space. When we were at the health department, we may have 10 people a week come in there.
And we didn't include these slides because we're mostly kind of talking about the model, but we did a study this past spring, just in terms of how folks are utilizing services and how satisfied they are with services. And it was just, I mean, it was really reinforcing kind of in what we're doing because it was people were incredibly satisfied in services across the board. We'll show you kind of the diverse services from pro-social stuff and kayaking trips and open mic nights and all that to the certain service program and different groups and, you know, on and on, all were very, very high. And input from diverse stakeholders has been key. So we'll share now a little bit about kind of what we see with our model. For us, it's very much about integration of harm reduction and recovery and community connection, with the idea that will reduce stigma and our overall goal of improving quality of life. And so we have these various kind of components or elements that we just want to kind of talk through. Sherman, you want to talk a little bit about the first one is the involvement in leadership. We prioritize the leadership of people with lived experience.
So that is the cafe.
Yeah, we didn't mention that. Thank you.
And when we opened, we had the cafe and the harm reduction office and a bathroom, and we've expanded 4 times since we've opened. It's been amazing. So one of the things was having that person, which it just happened for me. And I was very, very fortunate to be supported. So I have turned into that big advocate, but in our community over time, like I ended up on the Fayette County Drug Coalition board. I just showed up and I said, you know, I'm a drug addict and alcoholic. I just want to make a difference. And now I'm the vice president of that board. But over time, it was just, I kept showing up and I kept staying true to the mission. So now we have 14 employees, including myself. Everyone that works at the cafe is a person that has been directly impacted by substance use and or mental illness, or even criminal justice involvement. I want to stay true to that because we're a place of second chances, and we love people well because we know what it's like. When someone walks through the door to see someone that they were out there in active use with, or whatever that pathway looks like, it's just life changing. And when we get to just be without any ulterior motive. And so then I guess I'll go ahead and talk a little bit about that. But the stakeholders, I was really resistant to taking money from other people throughout the state, Brandon George being one of them, because I didn't want to let him down. And so I kept putting him off and putting him off. And then finally, when we opened in June of 20, when we became an RCO, or not a certified RCO, but we joined the network. And I believe that was life-changing for the cafe with getting our mission out there and now where we're at. Our people locally, there's pretty much not a day that goes by that somebody doesn't bring a donation to the closet. Or last year we had a high school intern. They were a set of twins. One worked for us, one worked at the prosecutor's office. And when she graduated with a community health worker certification. Ivy Tech has been huge. We have interns from Ivy Tech that now have come to be employees. Just many partnerships. The health department, our commissioners didn't want the program. And we didn't want it to go away. So that was a gift to me as well, when that commissioner voted that we could keep the program and take it from the health department. So our county health officer oversees the program, but it's ours. And to get it out of the basement of the courthouse where, you know, there's the activity, and we had nurses that they would literally spray Lysol after someone would walk through. And just, you know, if you don't know, you don't know, and stigma is real, and so is judgment. And so that was a huge gift too. So leveraging resources, it's just been about just advocating through social media and just showing up. And then now that we've employed several people and they've got college degrees and they've bought houses, they see our community around us, sees what's happening there. And we're getting ready to put the IREX program in the county jail. So we've come a long way in Fayette County. And community corrections just showed up last week, and they're now going to let work release come to meetings. And that's just been no forever. So they get to come to 3 meetings a week, and they want to be trained in Narcan down there. And I said, well, sure, let's do it. And so the brick and mortar space, we do have a street outreach vehicle, and that's much needed. And we're getting ready to get a larger one, because sometimes people won't come because of stigma. Sometimes they don't come because they can't, or whatever it is. So going to them and providing resources. It's just a cafe on wheels. And if we ever lost our physical space, I'd be okay with that. And just as long as we can go and be. But it did change, and it went from me to now, like I said, there's 14 of us.
And having the physical space has been really key. I mean, the thing that I'm always just amazed at when I visit the cafe, or when Charmin sends pictures and stuff, it's open every Friday and Saturday night as well. And the crowd, I mean, it looks like it's usually a packed house. And it's really diverse in terms of who, you know, community members that show up. And so you've got folks that are just coming for pro-social just because they want connection, and they want to hang out and have fun. You've got folks coming for food, to get clothes, to get new syringes, to all kinds of things. And so in terms of the traffic coming in and out, it really does feel like a space, not only where everyone's welcome, but where many different people are very comfortable.
We have activities every Friday and Saturday. We're open 4 to 10. So we serve a meal, and then we have mutual aid support group at 6 if they choose. The space is big enough now where they can stay out front or whatever if they don't want to join the group. And then after that, the euchre tournaments, karaoke, open mic night, and we live by the river, so we do a lot of kayaking. And just bonfire. We got a bonfire coming up, and then next weekend we're going to serve for trick or treat. It's learning new skills that you don't know, or else you've been beat down maybe as a child. And I didn't have a voice, and I knew that I had no self-esteem, and my dad told me that I was worthless and I would never amount to anything. So when it come to a speech at school, I would skip. I didn't want to get in front of the class, or being forced to sing out loud. It was horrible. I've learned to live life, and I like who I am today. And I want to give those gifts to other people. And that's what we do.
Yeah.
We are adult focused, but all of our events, we always make it family friendly. And I say adult focused, but if somebody's 15, they're coming. Our space isn't big enough to integrate the toddlers, and that's just a whole nother animal for us right now.
But part of that is the welcoming everyone, and keeping a very low barrier. I'm sorry for that a little bit.
Absolutely. So we are a certified recovery community organization. So what that means is we're an other behavioral health center. We're billable. If someone chooses to receive ongoing services and if they want a recovery coach plan, and if that's what they want, and they want to meet one-on-one with one of our coaches, then that's absolutely what we'll do. But if they come around and they just want to volunteer or be a part or food or a shower, clothing, then we don't have paperwork. We don't, we want to know people before we put them through all the invasive background. And I learned that through harm reduction. At one point in my life, I would have said harm reduction was enabling. I didn't even know strange service programs existed when I was out there. And as soon as I got that little $8 an hour job down there in that basement, I knew we had to do more because they were just getting supplies and going. And my first person that I got into treatment, I felt like I had really accomplished something. I got him into a detox center, and 3 days after he got out, I got a knock at the door and they found him dead because there was no then what. And then that's what we get to be. We get to be the then what too, because we're there providing services or just a space to come and hang out. And people do. All of our services are free, the coffee, the water, the food. We never ask them for nothing, except to help.
Is the shower in your RCO space?
Yes.
It's all in it, yeah.
When
I
we
don't know how
started
we're doing
knocking
it.
out walls, oh, I'm sorry.
I think.
I don't have a slideshow or
So,
anything.
real
You guys
quick,
are doing great.
we,
We're
our first, so we opened in June, August, our first overdose awareness event, there was like 30 some people out on the sidewalk. So, we got it, we need more space. So we went through the wall and now we have a kitchen and we just kept going through walls and there, we took and made a shower.
Yeah.
And we have a washer and dryer in the shower area. We have a closet called Whitney's Closet. I met a family that had lost their daughter to completion. And I asked if we could do something in her memory. The closet is just stocked full, just men's, women's clothes, shoes, blankets. Her parents, the first winter after they had lost her, they provided blankets, hand warmers all winter long.
Wow.
Then we have a coach's office. We have a meeting room. I wish we would have brought pictures. And then I have a whole office now. I graduated to another wall we went through. And then we have a harm reduction vending machine.
Yeah,
So that vending machine, I put everything in there that is safe that I possibly can. Safer sex supplies, wound care kits, hand warmers, food, hygiene items. We just got some supplies from
That's
Ship
awesome.
Happens, but it's free. Now, the wood up there, we do have a whole screen. We had to, I had somebody sleeping in there and so I had to move the machine forward and, but that machine is a gift. And we have Narcan in there too, fentanyl testing strips.
Yeah.
Whatever I can get in there, I'm putting it in there.
And we talk a little bit about being person-centered, our approach.
So it's definitely about them, it's not about my pathway or my coaches or what they want. We also, I have someone, we don't call the cops if somebody's threatening suicide. Like we talk about it and then I'll say I need an informed decision before we do that because people don't need carted off in handcuffs
No.
to a padded cell or to a paper gown. But what we can do is sit with them, or I can take them to, if they want to go and admit themselves, I can take them to do that too. But I try not to cause additional harms. That's the goal, to love them right where they're at, to treat them like they're humans, and to know when they walk out the door that we offered all that we could. And I hope that they know they were loved well and that they matter.
Beautiful.
Aw.
The last one, this page is about just serving the whole community, that everyone's welcome at the cafe.
We have a sign outside, that sign right there says the place where everyone's welcome. And that's it. Everybody's welcome.
And we've had other kind of anti-stigma campaign and other activities kind of going on alongside, but just to kind of push us forward a little bit. Oops. There we go. We'll talk a little bit, Sharon, we want to talk a little bit about the different services?
Well, I think I kind of did. So right now, like all of our coaches are certified to test too for Hep C and HIV. Naloxone, fentanyl testing strips, everything that we can give, we do. All the coaches are either in the process of being certified as community health workers and recovery coaches. The vending machine, wound care kits. So recovery is a part of what goes on around the cafe, but that is not our main focus. It's really about the person, and that's it. So when we started looking at models, and we found one at one point, it was called a hybrid model. And so it was a recovery community organization and a harm reduction services. But I don't think that's us. We're harm reduction focused, and that's it. And that's what makes sense. That's what saves lives.
Yeah, absolutely.
We don't do start over tokens. Our groups are all pathways. We do have a men's group. We have people that come to men's group that were assigned a different gender at birth, and that's okay. That's exactly what we want there. We want people to be who they are, or who they are, not even know who they are. And then we want to support them on their journey to finding out who they are and what kind of eggs they like. It's a movie, Sandra Bullock, 28 Days. And treatment, like, it is, if they want to go to treatment, we'll take them. I even went and bought 3 packs of cigarettes yesterday for a young man going, because I used to smoke and I know what it's like. So we just have to make it make sense. That's it. They're human beings, and I would say there's not a person that's ever lost someone that used to, that tough love. If it's my son, I need my child to know I love him. And if they can't come to me, then where do they go? People need to know they're loved and they matter. I don't really think we have a drug issue. I think we have a mental health crisis. We have a trauma issue. So let's get to know people. Let's find out what they need and how we can help them have a better quality of life.
Yes.
And if it's a sterile syringe, I'm about it, because them wounds are nasty and they hurt.
Thank you so much.
Thank you guys for, sorry, I just took up all your time listening to you.
That's perfect.
So she was a gift to me, and now we're building a paramedicine program with the Wayne County Fire Department. We have 2 coaches there. We're looking at putting a second site there, putting 5 periods in the jail. I have more work than I knew what to do with, really, and support.
Thank goodness you're there.
Central Avenue. What, Nick?
I said, thank goodness you're there.
Oh,
Yeah.
You're very inspiring.
well, thank you.
I want to know how we do it here now.
Well, I guess, do you want to, before we go into big questions, should we try?
Yes.
I don't know how I'm gonna follow that lead, but I'm gonna give it my best shot. I don't have a fancy slideshow or anything, and I've only been with the Recovery Center since May of 2022. They did start in the basement of a recovery house called Next Step. And then in 2020, they became one of the first RCOs along with you guys in the state of Indiana. As you were talking, I was thinking of different things that have happened since I have gotten there, and the meeting people where they're at, how important that is, and how I didn't have an understanding of that until I got to the recovery center. And so just to add a couple stories that I felt like would be beneficial for you guys to hear. When I came from the Rockville Correctional Facility, I was an addictions counselor there. And, you know, things at a correctional facility are like this, you know, and there's no blurred lines, and you know, you can only do so much. When the first week that I got to the Wabash Valley Recovery Center, a young man came in there and he was having a manic episode, and he wasn't violent towards us, but he was very erratic and throwing stuff, and coming from the Rockville facility or whatever, I'm like, we need to call cops or something. You know, Christy said, no, we don't do that here. But I didn't understand at that moment. And so to make that story a little shorter, this happened all throughout the week. Well, Friday came around and he came in again, asked to use the phone. And they're like, yeah, go ahead, and set the phone on the counter. We was calling his girlfriend, and he was very mad that she wouldn't come get him, but he had kept saying he was gonna get help, and then he kept using and this stuff. And he took the phone and slammed it on the receiver, almost to the point where it broke. I'm pretty sure something did break on it, but anyway, that young man ended up getting help, you know, because we ended up taking him somewhere to the hospital to get medically cleared, and he ended up getting on the right medication. He ended up back with his girlfriend. They have kids, you know, and stories like that give such an understanding to meeting someone where they're at. And it was such an eye opener for me, because my automatic reaction was to safety. And I'm 10 years in recovery, and I was violent in my addiction, and I'd forgotten. You know what I mean? Like, you know, I was a person too back then. He's a person. Another story, a lady came in there and she got sent to us from the Council of Domestic Abuse in Vigo County. She was using, and they'd caught her using. And she had come in and out of the office, and we were trying to help her, meet her where she was at and all the things. And she OD'd in our bathroom. And that was the first time I had to use Narcan. Naloxone is what it's actually called, what we have. And we saved her. We had to use 2 of them on her. Had she been somewhere else, she wouldn't have made it. She's starting to get a relationship with her kids. She's doing phenomenal. She couldn't even carry on a conversation with us before, and now she can. And seeing all that stuff has just been amazing. And I love what I do. We get to do all kinds of cool stuff like that. And those stories are what matter, right? I mean, even if you save one life, save one family, and them being loved, like Charmin said, is so important, because people don't want to deal with you when you're real messed up. They just don't. They don't understand. And if they haven't been there, they really don't understand. And
Well,
when
it's pretty annoying sometimes.
yes,
I mean,
yes, yeah, right, it is. And so, I can remember the few people that did love me in my addiction, who made a difference, and that I turned back to. And so having these organizations all throughout Indiana, is a game changer. And, you know, I'm thankful that I get to be a part of it. Now I'll just tell you some of the stuff that I was brought on to the Wabash Valley Recovery Center to be the CLEAR coordinator. And what that stands for is Choose Law Enforcement Assisted Recovery. Now I get to work hand in hand with the prosecutor. I've built relationships with local law enforcement, the sheriff's office, Terre Haute Police Department, and right now we're expanding to Vermilion County. So when an officer, we have peers who are on call 24/7, and I am on call every day of the week, day and night. And if an officer goes to arrest someone, instead of arresting them, they can call us and say, we have this person, can you meet us at the center, or can you come to the scene and pick them up? And we get to do that now. And we've gotten in a year, so the program started October 30th of last year, and in a year we had 44 referrals, 4 graduates of the CLEAR program. And what that looks like is, you know, we make recommendations for treatment. We ask them what recovery looks like to them, and we try to meet them somewhere in the middle, because being involved with the prosecutor's office, you know, they want to see that change, and they want to see their life getting back on track. And we've seen, you know, huge changes in people through this program. And, you know, we also do jail mentoring. We got a transportation grant that we just opened up to the community. Anybody who needs a ride to doctor's appointments, any criminal, you know, probation, a court date, anything really. We are able to go pick them up. We have 2 cars. We have a transportation coordinator, a driver, and then we always pick rides up if someone needs it. We have the recovery housing scholarships. A lot of times when people get into recovery, they don't have any money, like for their initial fees. And so we pick one recovery house, not one per month, but we will give one recovery house, one recovery scholarship a month. And so that's how we manage the funds. We do Narcan training for the local schools. So we just got to do it at Rose Hallman. It's a college, and they requested a bunch of Narcan to be in all the IED things that they have throughout the campus, and they wanted to know how to use it in case they needed it, which was pretty cool. We just started a crisis counseling program in Sullivan. They had a tornado that went through there, and we were able to oversee a grant. And so now we've got peers in Sullivan helping them, as a result of a tornado going through your town, a lot of people self-medicate. And then,
So a peer crisis counselor?
it's a crisis counseling. So, but
with
it's
peers?
paraprofessionals.
Okay,
And so,
gotcha.
yeah.
Okay.
Yeah, so
Sorry,
it's not
I just wanna
necessarily
clarify.
peers with lived experience, so, but they are, so there's two of them have lived experience, and they work at the Freedom Connection. ECRC, so, yeah, Freedom Connection
Okay.
in Sullivan, and then, my daughter actually is the other one that gets to do it. She gets to work with the youth, in the high school.
Oh,
And do
wonderful.
a group with
That's so
them for
cool.
the ones who are struggling. A lot of them have PTSD, they're having a hard time sleeping at night. And, while she's not a counselor, she gets to sit next to them and say, they can talk to her about it and feel comfortable. Because a lot of them have a hard time talking to people. And we're working on getting our peers into the emergency rooms in Vigo County and then in Vermilion County. And we are blessed to have Christina Gruner at our at the Wabash Valley Recovery Center. She's also a radiology technician. And so she works in the hospital already, part-time, and then works with us part-time. And so that connection's been able to be made. And we serve 7 counties. And so those counties are Clay, Vigo, Sullivan, Park, Greene, Knox, and Vermilion. And I think I covered everything. We do so much. I wrote it down, and I've tried to, and even sitting here, I've had to jot a few more things down just because there's so much. And we have a recovery cafe in Terre Haute, and we have one in Sullivan as well, that we're actually getting ready to start overseeing those, but Next Step is doing it right now.
Thank you for sharing. Does anybody have any questions? I know that we've got a lot of curious people in this room or online.
I had a question. So for either one of you guys, what is funding look like for I know you have you mentioned grants to get started, but with sustainability plans of finances.
Great question.
Yeah.
So, part of that becoming a certified recovery community organization, we are now able to build. That's a whole nother animal. And I worked for another fiscal agent, and that was their partnership. And we quickly realized that it wasn't working. So, we separated as of July 1st last year. I say we became all grown up and independent. And it got to the point where at one point, because they didn't give us any of our funding that we had there, we were going to literally have to take the title to get a loan for payroll. Now I'm in a space where the opportunities, it's a crisis. We're in the midst of a huge crisis, and it's not going anywhere. So the mental health piece, I have great partnerships throughout the state, and funding and sustainability will turn into billable. But I have more work and funding than I
Through
can.
IOP, Sherman, or how are you billing for those?
We're not billing yet. Right?
Yeah,
But you
we're
plan
not.
on
We
it.
are able to. I just haven't got that set
Oh,
up.
gosh, that's bad.
So I started life at 39 years old. I served over 13 years inside of prison and just in and out all my life. My mom was my first drug dealer, and then I share this because it was who I was, and my son. I ended up doing drugs with my 19-year-old son, and then I had a 7-year-old. So now my son's 30, and he just became a certified recovery coach a few weeks ago. And a totally different life. And then my youngest will graduate here in December. And there's my cycle breaker. I got to learn a different way to be. And that's the gift of it. And I share my story openly because I know that if I'm what I went through and all the childhood issues, I'm not alone, and there are other people too. And I'm sorry, I didn't hear what you asked. I was
Oh, no, I
talking.
was talking about, it's the same bill.
Oh, the billing
What
piece.
Ashley was talking about.
Intensive
I-
education. or-
Is it gonna be IOP
No.
eventually? Is that how you're gonna be able to bill eventually? What kind of
No,
services? are you
so
gonna be able to for?
we're considered other behavioral health.
Okay.
So through the Department of Mental Health and Addictions, we are able to, we had to go through this big, huge process,
They can build peer services.
Yes,
Oh,
hour,
yeah.
hour to
Yeah.
hour, just hour to hour, 1-to-1.
That's what you guys are
group.
doing.
We don't.
You're
Our
just on a
services
grant.
are free, yeah, on grant.
Right,
Right now.
grant funded as well.
Okay,
And
I'm
that's-
just curious.
Eventually,
No,
that's what we're
no,
getting into
it's-
too,
And
but
it's
We haven't
needed.
gotten there
right.
either.
I'm just not ready to tackle that.
Yeah.
Yeah.
That.
And I will just say to kind of, one other thing about with your question with funding, we did start with federal, we started with some federal funding, but then over time, I think we quickly kind of diversified, like Sharman said, with state funding. There was also, we had more opportunities, financial opportunities coming to us than we could keep up with, and so we had to turn a lot down. But there's a lot of, even like private foundations, like the AIDS, Broadway
Broadway
cares.
Cares. I'm very protective of our program because oftentimes
Lots of
people
fun
want to
members.
come and see and set and collect data. And it's not a circus. These are my people. When COVID happened, they wanted to come, like people just kept reaching out and they wanted to interview because the opiates and the opiate use and then having COVID and do they get treated or whatever. And I said, what are you going to do for them? And they're like, well, we'll give them a goodie bag with mask and sanitizer.
Yeah.
And I'm like, no, because their time is valuable. They're worth it. They deserve to be treated just like anyone else. But street outreach, this is the first time I've gotten any funding from my county. I was under the street outreach grant and it was ending. And my county, it's just life. I hand out syringes. And so the mayor is really not a fan of the program. So they didn't write me in the grant. And I got a phone call when we were in California and the state said, we're gonna give you the funding to continue street outreach through the opioid match grant.
Awesome.
So I think it's about integrity, doing what you say you're gonna do, staying true to the mission, and it's a lot of work. But it's worth it. And then it's also exhausting and people die. So it's heavy, but
And that's actually what I wanted to get to, because we had for us, we had a client basically that was frequently, we responded on. And through my position, tried to find him help. Unfortunately, he refused the help and he ended up dying in a fire. And the effect of the firefighters, because they had a person contact. So what is the impact and how do you overcome that when you have an event like that?
So, and it'll sneak up on me. I mean, I'm sure you know that. It's about self-care, and supervising the coaches, asking them what they're doing. What are they doing for their own recovery, their families? I have coaches that would work 12 hours a day, 7 days a week if I would let them. I don't let my teams do more than like 10 hours of street outreach a week because while it's the best part of the job, you're dealing with people that are unhoused. And so we try to, at trainings, we have ongoing CEUs and things like that, but I think it's our relationship and the support that we have there for each other. That's it. Cause you can't, and you just can't. I stopped going to funerals, for me, because I had to. And then I knew after starting the cafe that I didn't want to do direct services anymore. I just want to make other recoveries and bring in opportunities for people. I'm 10 years in recovery and I still don't date. The longer I'm in recovery, the more I realize that my childhood was very abnormal. And so I don't really say they're triggers. I'm just aware. And I've created a good life for my son and I, and now I'm a Mimi. And so it's just about learning to deal with life as it comes and accepting the past and that's it.
I think that's amazing, Charmin. There is no handbook for this work in a weird way. And it's kind of something you just have to like talk to people, connect, and get through. It's really amazing what you've done. Like, we've looked at you in awe. I'm just really glad you're here, and I'm really glad that your program is running. And whatever. I can't say enough.
What I want to say, what I've learned with working with public officials is there is that brotherhood too. And I think we can't make it mandatory, but we have to do better for our servants, our public servants. And I always have an opinion, but I think harm reduction is about building bridges with law enforcement. And even if we don't agree, our goal is to, to make the streets safer and to do something to make change. And I feel like that law enforcement definitely have a heavy burden. They see it every day. They get kicked, cussed, spit on, and it takes a toll on them.
And the building the bridges, I mean, I would say law enforcement is key, but I mean, you've been working that. I mean, so much of that goes back to like the leading with integrity and operating with integrity. So that, and over time, I mean, it's taken time, but we've seen community relationships shift. And we've seen folks that have been resistant from the beginning showing up.
Law
to the
enforcement bringing
cafe.
people there.
Yeah, it's been pretty incredible in that way. And law enforcement earlier on contacting Charmin instead of bringing someone in, saying, what should I do? I have this situation. Can you come with me? Right? Early on.
And the sheriff now, like, he's all about the 5 recovery coaches going in the jail. They'll be in there Monday through Friday, 40 hours a week. And,
yes. So it's the building integrity, but it's also treating everybody with respect and love, both all those that we're serving and all those that we're building relationships with.
And I think I see Nick, you've got your hand raised.
Yeah, Charmin, how integral was getting the building? So like that's what we're looking at now, and getting a building seems to be like the only way it works. How important was you getting your own space?
It was community changing because, like I said, whenever they contracted me to not let the harm reduction program close. So we were in that time frame. It was down and it had been closed for another 6 months after the hospital shut down. And so I was like, well, we need more than just the SSP, because people come, they get their supplies and they go. So there's no relationship other than we see them and we know, a little. And then when Meridian offered the space, and the reason the commissioner really voted for it is because he was like, okay, so then they'll get supplies, they'll get treatment because they're there, the referral will go right to there. And that's just not realistic. But so then, like I said, we saw the stigma immediately, and then COVID happened. We did bicycle deliveries and then the parking lot. And in January, we got the key to a space that was probably needing condemned. Volunteers helped me make it what it is. So there's beautiful rock work in there. And now he's my board president, but people that had either been impacted by substance use or suicide or just knew someone. I also I go to a biker church and I asked my pastor, I was like, preach, can you check this out? And so we went there, it was terrible. And he's like, yeah, we could probably do something with it. Needless to say, he didn't do anything, but
he may not have, but it was an outpouring of community folks that just volunteers coming in saying, I can paint, I can do electrical, I can do stonework, I can do, right? I mean,
yeah, like the paint was free, our benches.
Yeah, with Next Step, I think they have the same thing,
Oh,
right?
yes,
They have
Next Step
construction
does.
companies
People want to help.
about that.
They just don't know how or what their part is. I have a lady that brings food once a month, just without fail. She'll serve a meal once a month, and that's her part because she gets too emotional when she comes. I have people that'll reach out and what do you need for the vending machine? Or now it's getting cold. Do you need tarps? Do you need blankets? And they want to be involved, or they want, but they also sometimes feel like they don't know how to communicate with because they haven't been there. You don't have to have been there. It is a common bond. You just have to treat them like they're human. That's it. They're just somebody.
So I do know just a little bit, and I could share that. The Next Step in Terre Haute built a pretty strong relationship with a local construction company. And they, every year, they like replace window, every year they choose a different project. And so they'll replace windows in all their houses, in their office spaces. And they do, it's all donated, like they don't charge them anything. And then they just had built a new building and they donated, I think most of the labor to Next Step. I think they just had to, you know, buy the stuff to build it, like the material.
Do they want another kid?
Right.
I'm
And
just
so
kidding.
I think that, you know, sometimes, and I've always told my kids, like, you never know unless you ask. And I think sometimes just asking someone and you know, is a first step to building that relationship.
The young lady that completed, her parents are Eagle Riders. This past May, they did a mental health ride and they donated $7,500 to the cafe. I've never asked our community to do a fundraiser or anything like that. And that was huge because it's all money that can go to the closet and food and the things that we don't get funding for.
Just be mindful of time. It's now 2:14. Are there any last little questions or words of wisdom that our guests have to share, or anything before we close out?
I would say I'm not really sure what you guys are, or what the plan is, or who's doing what, or if you guys are applying for opioid money. I don't know what you're doing, but I be inclusive of all people. Remember, like, if it's the person in active use, they're the ones that need the space the most. One time I had a recovery coach say, well, the SSP is a trigger. And I said, well, what are you doing to help them learn how to deal with triggers? Like, you know, I've been on calls where other health departments won't let their SSP people use the bathroom. And, and I just said, I mean, I just can't imagine. I've been that person. I know what it's like.
Thank you guys so much for
Just
being
meeting
here.
people where they're at. Are you guys looking to get an RCO here? Is that what you're
Yes.
doing? Okay, yeah, reaching out and building connections and, you know, building relationships with people in the community who can support you, you know, who aren't gonna try to make rules for you,
Right.
you know?
More and more barriers.
Right, yeah, and, yeah, just work on, building the resources, because, yeah, that's important too, knowing all the different things that people need and all the barriers that they go through that keep them from recovery. Yeah, and loving them. I don't think I could say it any better than the way she did. She put everything, in great perspective.
The only thing that would, for us to stop someone from coming back is we've not had only one situation, and the young man was, he had schizophrenia. And so, and I hated it. It broke my heart to have to stop him from coming, but it turned into where he had some sexual assault charges, and then he had touched one of my female coaches, and it broke my heart. But we've never had an overdose. We've never had a fight break out in the cafe. There's no one been busted for dealing drugs. There's like all of these beautiful things, and you get to see miracles every day.
We have all kinds of stuff happen at our place, but it's a little different than a cafe, so it's, yeah.
It's amazing. It's amazing what love and compassion will do, right?
Yeah,
Absolutely.
So and our website, we have a website. It's called harmreductioncafe.org.
Yeah.
Love that plug there.
So it's people stop by, they'll Google for food and then they'll show up and I'm like, food? Well, we'll feed you. But, we're not that kind of cafe, and I didn't know the recovery cafes were gonna be what they are.
Yeah.
We're gonna take that cafe piece away. I say we serve radical love, compassion, dignity, and respect. That's what's on the menu.
Serving radical love. I like that.
Yep.
I like that too. Well, thanks so much for joining, and we'll, I'm sure, be in touch with you as we explore this further. But yeah, I'm gonna cut off the recording, but thanks so much for joining us.
Thank you. Thanks for having us.
Thank you, Sherman. It was amazing, as always.
Thanks, Nick. I'm sure you're not wearing a sweater out there in Arizona.
No, I'm not. No, I'm not.
Bring back some good stuff.